Good afternoon and welcome to everyone joining us here in Washington, D.C. Office of Mathematica Policy Research, and also to everyone listening in via webinar. My name is Yanni Ben Shalom and I'm a senior researcher here at Mathematica. It's my pleasure to welcome you to our Disability Policy Forum and webinar on services and supports that promote employment among people with disabilities. The Center for Studying Disability Policy was established in 2007 to help build the evidence base for sound, effective disability policy. Findings from CSDP research can help inform disability policies and programs across the nation to better meet the needs of all Americans with disabilities. One way that we do this is through our disability policy forums, and today's event is our 30th such forum. And we look forward to your input, feedback, and participation in today's discussions. Employment rates among people with disabilities have remained consistently low over the past 3 decades. The low employment rates have been accompanied by high poverty rates and increased reliance on public programs. The Social Security Disability Insurance Program, which is the largest income support program for working-age people with disability, has grown rapidly during this period, reaching almost 11 million beneficiaries as of July 2014. Research has shown that few Ssdi beneficiaries work in a given month. These trends have put a spotlight on programs and policies that promote employment of Ssdi beneficiaries, such as vocational rehabilitation services provided by Ssdi agencies and Ticket to Work. Such programs and policies are important because employment is the only solution that can both reduce federal expenditures and improve the economic well-being of this vulnerable population. Our speakers today will discuss some of the factors associated with achieving return-to-work milestones among Ssdi beneficiaries and the services and supports that can help people with disabilities find and keep a job. First, Arif Mamoon, an Associate Director of Human Services Research at Mathematica, will present on how beneficiary characteristics, local economic conditions, and the timing of benefit award are associated with achievement of return-to-work outcomes among Ssdi beneficiaries. Next, John O'Neill, Director of Disability and Employment Research at the Kessler Foundation, will highlight the relationship between state VR agency services and return-to-work outcomes among Ssdi beneficiaries. After that, Noel Denny Brown, a senior health researcher at Mathematica, will describe some of the services and supports that people with disabilities use to find and keep a job, and how these services and supports are accessed and paid for. Finally, Dave Wittenberg, also a senior researcher at Mathematica, will join us to offer his insight and perspective on all of these findings and their implications for promoting employment among people with disabilities. Now, a few housekeeping notes. Our session today includes both an in-person and an online audience via live webinar. To help ensure the highest possible sound quality for our webinar participants, we ask that those of you here with us in DC silence all of your electronic devices. Please note that we are video recording today's session and may capture images of some of you in the audience. The video will be posted on our website later in the week at www.disabilitypolicyresearch.org. We will be trying something new during today's forum in an effort to create a more interactive experience for the online audience. Throughout today's presentations, we'll be asking our webinar audience to respond to several questions, one for each presentation. When this happens, the online audience will see a question pop up on the screen, and you'll have 2 minutes to select an answer from the multiple choice options and press submit when you are done. When we do this, we'll also do a quick survey of the in-house audience. Each presenter will also provide the answer for his or her question during their presentation, and the actual results will be revealed by Dave Wittenberg when he speaks. At the conclusion of the presentations, we will entertain questions from both of our in-house and webinar audiences. For those of you participating via webinar, please submit your questions electronically through the Q&A panel on your screen at any time, and we will alternate your questions with those from our in-house audience. Now, I'm pleased to turn the podium over to Arif Mamoon.
Thank you, Yanni. Good afternoon. I'm going to present results from an analysis of return-to-work outcomes among Social Security Disability Insurance beneficiaries. This is joint work with Yanni Ben Shalom. To begin, let me acknowledge NIDR and add the usual disclaimer. This research was funded by the National Institute on Disability and Rehabilitation Research under the Employment Policy and Measurement RRTC. However, the opinions and conclusions are solely of the authors and don't reflect the opinions or policy of NIDR or any other federal agency. Let me start with the motivation of this study. With the growth of the DI benefit rolls and the anticipated exhaustion of the DI trust fund that Yoni referred to, policymakers are strongly interested in promoting employment among DI beneficiaries. Targeting specific groups of DI beneficiaries may also be of interest, as indicated by recent initiatives that target specific groups of beneficiaries. For example, the mental health treatment study targets beneficiaries with a primary impairment of either schizophrenia or affective disorder. The accelerated benefits demonstration targets new awardees under age 55. The youth transition demonstration targets youth. And more recently, the initiative to promote readiness of minors in SSI, or the PROMISE project, targets children on SSI. Now, to target any future policy or program for a specific group of DI beneficiaries, policymakers need more information on what factors are associated with return to work. So the primary question that our research addresses is, how are beneficiary characteristics and local economic conditions associated with return to work outcomes? We specifically focus on age and impairment type, state unemployment rates and other state-level effects, and timing of award. We present a long-term view of what factors influence outcomes among DI beneficiaries. We take a 5-year view since an individual has been awarded the DI benefits. And we use a 5-year time horizon because previous research has shown that most beneficiaries who return to work do so within 5 years. For our analysis, we use data from administrative records from SSA and also from the Rehabilitation Services Administration, or RSA. So we merged data from SSA and RSA records and matched them at the individual level. We also use monthly state unemployment rate data from the Bureau of Labor Statistics. The analysis includes new working age DI awardees from January 1996 through December 2004. The analysis sample excluded beneficiaries who died or reached age 65 within 5 years of DI award. The final analytic sample includes over 417,000 beneficiaries, representing more than 4 million DI beneficiaries who meet our sample selection criteria. For our analysis, we look at 3 return to work outcomes: service enrollment, completion of trial work period, and suspension or termination of DI benefits due to work. All 3 outcomes are measured, as I said, over a 5-year period following the individual's DI award. Service enrollment measures enrollment in employment-related services from a vocational rehabilitation service agency, from a state vocational rehabilitation service agency, or other employment networks established under the Ticket to Work program. The other 2 outcomes, trial work period completion and STW, are related to work incentives offered to DI beneficiaries under the existing program rules. Trial work period allows DI beneficiaries to work and earn at any level over a non-consecutive 9-month period within a 60-month rolling window. So our measure looks at whether a beneficiary achieved trial work period completion within the 5-year window that we're considering. After the end of the trial work period, beneficiaries enter what's called an extended period of eligibility. Except for a 3-month of grace period, beneficiaries earning at or above the substantial gainful activity level will lose their benefits during the 36-month period of extended period of eligibility. So in other words, during the EPE, the extended period of eligibility, their benefits would be suspended. After the end of the EPE, their benefits are terminated in the first month of substantial gainful activity. So the outcome measure we use is whether a beneficiary achieved suspension or termination of benefits during the 5-year window we analyze. Okay? Now, quiz time. As Yoni mentioned, we added a quick poll for the webinar audience to respond to this question on the screen in an online poll. For the audience here, we're going to do a straw poll by show of hands. So the question is, which DI award cohort had better 5-year return to work outcomes? Is it those who entered DI in 1996 when the economy was expanding, or is it for those who entered DI in 2000 at a peak of economic expansion? So I would ask you all to raise your hands if you think answer A is the correct answer. Okay, thanks. And now please raise your hand if you think answer B is the correct answer. Great, thank you. The webinar audience will have a few more minutes to respond to the poll, but let me get back to the presentation, and I'll start with describing some descriptive results. On this slide, we're showing a bar chart with the share of new DI awardees who achieve these 3 outcomes by age group. And across all 3 return to work milestones, the share of awardees who achieve these milestones is the highest for the youngest age group, and it decreases with age. So let's use TWP completion as an example, which is shown by the bright blue bar in the middle. As we can see, beneficiaries ages 18 to 24, about 19% of them complete TWP, compared with about 12% for beneficiaries ages 30 to 39 at award, and 4% of beneficiaries ages 50 to 57 at award. In the next slide, we present the share of awardees who achieve these 3 return to work milestones by impairment type. In our analysis, we use 7 impairment types, and these are sensory impairments, intellectual disability, other psychiatric disorders, affective disorders, other physical disorders, other musculoskeletal disorders, and back disorders. What's apparent from this slide is that there is considerable variation in the share of awardees who achieve these outcomes by impairment type. Sensory impairments, for example, has the highest share who return to work across these 3 outcomes, whereas other musculoskeletal disorders and back disorders have the 2 lowest share who return to work as measured by these 3 outcomes. Interestingly, intellectual disability, or individuals with intellectual disability who achieve TWP completion, is the 2nd highest among all these impairment types. However, it's the 5th highest category who achieve STW. What that implies is that a high fraction of individuals with intellectual disability who achieve TWP completion do not move to achieve suspension or termination of benefits. Now, these differences in outcomes across impairment groups might be driven by differences in age distribution of beneficiaries across impairment groups and vice versa. So to account for this, we conducted multivariate analysis where we controlled for individual characteristics such as age, impairment type, gender, race, ethnicity, education level, and also programmatic features such as the monthly DI amount, SSI recipiency status, whether they're eligible for Medicare at award, and of course the DI award month. We also controlled for state characteristics such as state unemployment rate and other state-specific effects. This slide summarizes the findings from our multivariate analysis, and we found that the likelihood of achieving milestones increases with having sensory impairments, being black, with years of education, and having DI award at the initial adjudication level at the DDS, at the Disability Determination Service Office. At the same time, likelihood of achieving these 3 return to work milestones decreases with age, having back and other musculoskeletal disorders, with monthly DI benefits, receipt of SSI benefits, Medicare eligibility award, disabled adult child status, and increase in state unemployment rate. Note that only a specific group of DI beneficiaries are eligible for Medicare at award. These include individuals with ALS and end-stage renal disease, and also those beneficiaries whose entitlement date is at least 24 months prior to their DI award month. Now, on this slide, we show the state-specific effects on the likelihood of achieving these 3 return-to-work outcomes that we analyzed. On the horizontal axis, we're showing the state of residence at award, and on the vertical axis, we're showing the state effects in percentages. As it's clear that there is large variation in return-to-work outcomes by state of residence. There are a couple other points that come out of this graph. One is the state effects maintain roughly the same rank order across these 3 outcomes. However, for service enrollment, there is considerably more variation in state effects than the other 2 outcomes. We also looked at the relationship between DI award month and the return to work outcomes. And before I show you a graph of these award month effects, and I'm using the word effects somewhat loosely here, I'd like to reiterate that because we control for individual characteristics, programmatic features, and also state characteristics, the award month captures unobserved factors affecting behavior among beneficiaries who enter DI at different points in time. These could include changes in state policy over time or changes in the composition of new awardees in terms of unobserved characteristics. So with that in mind, let's take a look at the award month effects for TWP completion and STW. On this graph, the dotted lines show the actual award month effects for each award month, and then the solid line is a 6-month moving average. What's clear from this graph is that there is considerable variation across award months in terms of the share who actually achieve these 2 outcomes. For example, someone who is awarded DI benefits in early 1996 seems to be more likely to return to work to achieve TWP completion or STW than someone who is awarded in, say, late 2000. Right? And let's add the service enrollment estimates onto the graph. As you can see, the relationship between award month and service enrollment is quite different than the other 2 outcomes. There is still some variation, but it's substantially different from the other 2 return to work outcomes. And now, finally, this is the answer to the polling question. So as I mentioned a minute ago, beneficiaries who were awarded in 1996 were more likely to achieve these return to work outcomes than someone who is awarded in 2000. To conclude, let me summarize the key findings from our study. Younger beneficiaries are substantially more likely to achieve return to work milestones, and beneficiaries with sensory impairments have the highest likelihood of achieving all milestones, whereas those with back and other musculoskeletal disorders show the lowest 2 likelihoods. These differences across age and impairment persist after accounting for other individual programmatic and state characteristics. We also found that large variation exists in the relationship between state of residence and return to work outcomes. And finally, timing of award may be capturing unobserved beneficiary characteristics. These findings could inform discussions about the following policy questions. Should SSA direct efforts to help beneficiaries return to work toward recent awardees under age 40? Should return to work initiatives be tailored according to impairment type? Should efforts to slow entry via early intervention focus on those most likely to achieve the return to work milestones under the current law? It would be also worthwhile to do further research on what factors explain variation across states and over time. Thank you. And with that, I'll turn it over to John O'Neill.
Hey, today I'm going to report on a study that looked at the effectiveness of state vocational rehabilitation services on DI beneficiaries returning to work. Standard funding and disclaimer. This study was supported by NIDRR through its Rehabilitation Research and Training Center on Disability Statistics and Demographics. And the contents of this paper do not necessarily represent the policy of the Department of Education, and the authors take sole responsibility for all views expressed. Several studies have suggested that vocational rehabilitation, state vocational rehabilitation services can improve employment outcomes among DI beneficiaries. However, there have not been any well-controlled national level tests of the influence of VR services on return to work among DI beneficiaries. As a matter of fact, the GAO has recognized that the evidence available in the literature does not establish a causal connection between VR and reduction in DI roles. The findings in these studies are typically based on observational studies where self-selected groups of DI beneficiaries apply for VR. The potential selection bias in these studies likely emanates from a number of unobserved characteristics, such as severity of disability or work orientation, that together influence who ultimately chooses to receive VR services. Thus, the purpose of our study is to examine the influence of VR services at the national level on the likelihood of DI beneficiaries returning to work. The study uses a research methodology that controls for extraneous factors by closely matching DI beneficiaries who don't apply for VR to those who do apply. This is my polling question, and I'd like to see people raise their hands in terms of which answer they feel is likely to be true. And the question is, how likely are beneficiaries who receive VR services to leave the DI program due to employment compared to a comparison group who does not apply to VR? Are they equally likely? Could I see a show of hands? Okay. Are they 4 percentage points more likely? Okay. Are they 8 percentage points more likely? Oh, one optimist. Okay, moving on to reporting out on the study. As with the Reefs study, we used 2 administrative data sources, the Social Security Administration's Disability Analysis file and the Rehabilitation Services Administration's 9/11 file. Data from these 2 administrative files were matched to create an individual record for each DI beneficiary. For our analysis, DI-only beneficiaries were drawn from the merged administrative data files. We created a base population using individuals who were between 25 and 54 and who were awarded benefits for the first time in 2000 and who did not die before 2010. From the base population, we created 3 groups. A comparison population of DI-only beneficiaries who had never had a closure from VR between fiscal years 97 and 2010. We also created a second group, an applicant group, that included new DI beneficiary awardees in 2000 who had applied for VR services in fiscal year 97 or later, who were closed from VR after an individual plan for employment had been developed, who applied for VR services within 5 years of their DI award, and whose time from first VR application to last VR closure was less than 5 years. This group was further subdivided in terms of who had applied for VR at different points in time. We subdivided the group into those who had applied 2 to 3 years following DI, 3 to 4 years following DI, and 4 to 5 years following DI. A third group was created, and this is the matched comparison group, who had never had a closure from VR for fiscal years 97 through 2010. We used propensity score matching procedures to create this group, which was in the end statistically equivalent to the applicant group on 34 of 36 observed beneficiary characteristics at the time of DI award. We matched on gender, age, race, ethnicity, education, impairment type, SSA, certain SSA application appeal factors, whether the beneficiary received a ticket, monthly earnings, and average benefit amount. This flow diagram depicts how we created the analysis samples. At the top, we have the base population from which we drew the comparison population. The base population also contributed the applicant group, that is those who had applied for VR within 5 years of DI and had closed after an IPE. The comparison group was used to pull the match comparison group, and those were the folks that were closely matched to the applicant group. The applicant group, as you can see, was further subdivided into the 3 groups which I had mentioned. The dependent variables were 2 dichotomous dependent variables drawn from the disability analysis file, and they were exactly like Arif's, 2 of Arif's dependent variables, which were the completion of trial work period and benefits having been suspended or terminated due to work. Logistic regression was used to estimate the relationship between VR service receipt and achievement of the above employment-related outcomes during each of the 10 years after DI award. I'm going to spend some time on this, describing this particular graph, because it is representative of the other graphs which I will be presenting. This figure shows 3 curves depicting the adjusted means for the proportion of DI beneficiaries being suspended from the roles due to work, suspended or terminated from the roles due to work over 10 years. The comparison group is represented by the green curve on the bottom. The match comparison group is represented by the red curve, and the applicant group is represented by the top blue curve. The horizontal black line shows when the applicant group applied for state vocational rehabilitation services. The 3 curves show very different patterns of change or trajectories. The comparison population and the match comparison group show very low levels of being suspended or terminated from the DI roles due to work, going from about 2% in year 1 and gradually increasing to between 7% and 10% respectively in year 10. On the other hand, the applicant group, the blue line, who also shows low levels, about 2% of being suspended or terminated from work before applying for VR services, shows a marked increase in STW after applying for VR services, jumping to 10% in year 4 and continuing to increase yearly to about 19% in years 8 and 10. By the way, those who, I think it was one person in the room who thought that beneficiaries who receive state VR services would outperform the matched comparison group by 8 percentage points was correct. The next graphs I'm going to present, I'm going to go through fairly quickly. The next 2 graphs show being suspended or terminated from work, being suspended or terminated from the DI roles due to work for applicants who had applied for VR 3 to 4 years after DI award versus the comparisons. We see a very similar pattern with the jump after the baseline period. And here we show a slide representing applicants, those who applied for VR 4 to 5 years out, and we see a very similar pattern. One thing I would like to point out, during the baseline period on this graph as well as the others, that is the period before the VR applicants, the DI beneficiaries apply for the VR, the baseline period, it looks like these lines are fairly close together, but in most instances, these groups are significant, or at least the matched comparison group and those who apply for VR, the differences even during baseline are significantly different, which is very important. I'll come to later. Here we're looking at graphs for the trial work period completion. This is for those SVR, those who had applied for SVRA services 2 to 3 years after DI award versus the comparison groups. Very similar pattern. This is for those who had applied 3 to 4 years after DI award versus the comparison groups. And this is for those who applied 4 to 5 years after DI award versus the comparison groups. The patterns are the same regardless of the outcome or the years when folks had applied to SVRA. Summary and interpretation of the results. We found that first-time DI beneficiaries who apply for VR services had better employment outcomes than first-time DI beneficiaries who didn't apply. For example, from among the first-time DI beneficiaries in 2000, of those who applied to VR over the next 5 years, 19% achieved STW, and the unmatched comparison population who never applied to VR achieved only 7% STW. These differences should not be interpreted as the effect of SVRA services because of selection bias. Selection bias can be due to many factors, such as greater work orientation, differential state vocational rehabilitation agency outreach efforts, family support, age, gender, etc. We tried to strip away some of these alternative explanations using statistical methods to control for these differences at the time of DI award. We also looked at the timing of employment outcomes relative to the timing of SVRA application to verify that differences were not simply differences that were observed prior to the state vocational rehabilitation application. The results are encouraging for a couple of reasons. Differences between the applicant group and the match comparison group remain substantial after controlling for a number of observable characteristics. These differences systematically increase over several years after SVRA application. However, we can't rule out selection bias altogether because even after matching, we found that DI beneficiaries who would go on to become VR applicants in the future were already more likely to have achieved trial work period completion and have achieved being suspended or terminated from the DI roles due to work before they applied for state vocational rehabilitation services. Thank you. And now I'll turn it over to Noel.
Thank you, John. Good afternoon, everyone. We're going to switch gears now to take a closer look at the services and supports workers with disabilities need to stay employed to provide a more personal touch to the statistics discussed earlier. This research was supported by the Centers for Medicare and Medicaid Services. This was joint work with my colleagues Bonnie O'Day and Stephanie McLeod. I'd also like to acknowledge and thank those individuals who volunteered to participate in this study. We know that employment supports are very important to workers with disabilities. We also know that workers have diverse needs for supports and accommodations that help to facilitate their performance in the workplace. These supports may include changes to the physical work site, assistive technology, or work accommodations such as changes to job duties, schedule, or location. There are several sources of coverage for employment supports. Some, such as durable medical equipment, may be covered by employer-sponsored health insurance or provided directly by an employer. Other supports may be covered by public health insurance programs such as Medicaid. However, to qualify for Medicaid, workers' incomes must remain below levels set by their state's Medicaid program. Oftentimes, workers pay out of pocket for essential work-related costs that are not covered by private or public health insurance. This study sought to explore what specific types of services and employment supports workers with disabilities who earn relatively high wages need in order to work, and also from where do these workers obtain these supports and what strategies do they use to obtain and pay for them. We focused on higher wage earners to better understand what supports this population needed to become successfully employed. In 2013, Mathematica held semi-structured discussions with 15 workers with disabilities who volunteered to participate and met the study criteria. We interviewed individuals that had a visual, hearing, psychiatric, physical, or intellectual disability, worked at least 20 hours per week, earned above 250% of the poverty level, which in 2013 was about $28,000 for a single person, and also had a work support need related to their disability. Convenient sampling was used to identify and recruit participants for this exploratory study. Specifically, we contacted several listservs for individuals with hearing and visual impairments. We also contacted several disability service and advocacy organizations to request their assistance in recruiting participants. The study sample is very select and different from the general population of people with disabilities in a couple of ways. All of the participants were competitively employed. Individuals worked in occupations such as government, advocacy, retail, publishing, insurance, education. 2 were self-employed. Also, we selected to interview higher wage earners to learn how they access needed supports. 8 participants earned more than $50,000 in 2013. In addition, 11 of the 15 participants had received Social Security benefits at some point in the past, 5 had received SSI benefits, and 6 had received both SSI and DI benefits. Of these 11, 10 later transitioned off the disability rolls because their earnings had reached a level that made them ineligible to receive these benefits. Participants had a mean age of 39 and tended to be highly educated. And of the individuals included in the study sample, 8 had a primary sensory disability, 4 had a physical disability, 2 had a psychiatric disability, and 1 an intellectual disability. Now, before I review key findings, I'd like to, again, poll the audience with the following question. Those participating via webinar, please indicate your response on screen, and those participating here in person, please indicate your response with a show of hands. The question is this: of the 15 workers interviewed, how many spend more than $2,500 out of pocket each year for work-related supports? A, 3 individuals, show of hands. B, 5. C, 7. Okay. This study is based upon a small, non-random sample of individuals, and thus the findings are not generalizable. Also, 7 of the 15 participants we interviewed worked for organizations that provide services to people with disabilities or make special efforts to ensure that their services and products are accessible. We were also interested in capturing the perspectives of workers with diverse support needs, so we selected to interview individuals with 4 different types of impairments. Through these case studies, we explored ways in which employees and employers used creative strategies to put needed supports in place on the job. This graph shows the number of supports participants used on the job, and it's organized by type of support. There was large variation in the number and types of supports used by participants, and not surprisingly, this variation was based on the functional needs of workers. The most frequently used support was assistive technology, and this was most often used by participants with sensory impairments, who accounted for half of the study sample. These individuals used communication devices and visual aids to complete job tasks and participate more fully in the workplace. The next most commonly used support was staff support, which encompassed both informal and formal support as well as additional supervision. 4 participants received formal supports on the job. This included a paid reader, a proofreader, a teacher's aide, and a secretary who assisted the individual with producing emails and written documents. A modified work schedule was the next most commonly used accommodation. Employers provided workers with a flexible work schedule, the ability to work from home, as well as additional paid time off. This next finding relates to the use of universal design features on the job. In simple terms, universal design refers to products or environments that are designed to be usable by all people with a range of abilities, reading levels, communication, and learning styles. In recent years, workplaces have become much more accessible to individuals with diverse needs and abilities. Participants relied on universal design features that are commonly used in the workplace, such as large computer monitors, wireless keyboards, phones with accessibility features, as well as ergonomic furniture. The remainder of this presentation includes a few personal accounts of the experiences of individual participants. JB has physical, visual, and psychiatric impairments. JB uses accessibility features built into her Mac laptop, such as the zoom in feature to enlarge print on the screen, and the sticky keys feature, which helps her to type. SO is blind. She uses Apple products that translate text to speech to assist customers with making purchases, checking email, and searching for information online. She also uses Apple products off the job to listen to music, watch television that's accessible, and even purchase Starbucks coffee. Participants with physical and sensory impairments reported that accessible transportation was critically important to finding and keeping a job. Accessible transportation not only increased their independence, but it also made competitive employment possible. 3 participants used a modified vehicle to travel to work. 2 paid for the vehicle out of pocket. 1 individual's employer later purchased a modified van for his use. The State Vocational Rehabilitation Agency funded the cost of a van lift for 1 participant, and her father funded the down payment on the vehicle. Participants used other modes of transportation to get to and from work. Some were driven by family members. Others used public transit, walked, or took a taxi. DW has a physical impairment. The most critical support needed to work is his modified van, which provides him with reliable, accessible transportation. DW's employer purchased his van with a wheelchair lift for company and personal use. Next, O is blind. The Metro system has accessibility features such as audible stop announcements and bumpy platforms that make it easy for her to use. O also uses a guide dog to help her navigate the transit system. O received her guide dog and training for the dog at no cost through a guide dog training program. We also learned that participants were very resourceful and used creative strategies to obtain equipment and supports that effectively met their needs. In some cases, through perseverance and ingenuity, individuals were able to obtain needed supports at either no cost or a discounted price. For example, one individual with a physical disability relies on handmade adaptive equipment to address her personal care needs. 2 individuals leveraged their resources to purchase discounted wheelchairs that properly fit them. 7 pursued employment at disability service organizations or companies that offered unique accommodations. Working for such employers made it easier for them to obtain necessary supports on the job. And finally, 2 individuals became self-employed because it provided them with a flexible work schedule and the ability to work from home. D has a progressive physical impairment. As an adolescent, she took stock of all of the tasks that she completed each day and worked with a family member to identify adaptive tools that would effectively meet her needs. When she couldn't locate a tool to help her perform a particular task, D worked with her brother to make it. She and her brother made a self-standing transfer board and a homemade reacher that she uses to gain control of objects beyond her reach. MI has a physical disability. She obtained a loan that was approved by the Federal Housing Administration to purchase her home. When there were no accessible FHA-approved homes in her area, she negotiated with the lender and later a contractor who equipped her home with accessibility features at no or low cost. Although many participants' work supports were provided by their employer or covered through their insurance, 13 individuals incurred some out-of-pocket costs for needed health services and supports. Out-of-pocket costs range from $0 to nearly $15,000 per year. Now, earlier, to test your knowledge, I asked you a polling question, which was of the 15 workers interviewed, how many spend more than $2,500 out of pocket each year on work-related expenses? 2 participants had no out-of-pocket expenses, 5 spent less than $1,000, 5 spent between $1,000 and $2,500, and 3 individuals spend more than $2,500 each year for needed health services or employment supports. Of these, 1 individual spends $5,000 on transportation, medication, and medical services. 2 others spend more than $8,000 per year, 1 for personal care assistance, and the other for orthopedic shoes, a psychiatric service dog, and wellness items. 4 participants went without needed services or supports due to high out-of-pocket costs. These individuals expressed a need for physical therapy, speech therapy, or personal care assistance. Barriers to accessing needed services included, in most cases, the item or service was not covered by their insurance. In some cases, needed services were covered by insurance, but the co-insurance payments were too high or the number of covered sessions was too limited. D has employed a personal care attendant to help her prepare for work. She was unable to receive coverage for the service through her insurance. This results in an out-of-pocket expense of about $9,000 each year. D fears that her condition will become more debilitating in the future and she will not be able to afford the additional attendant services needed to accommodate it. JK is visually impaired. His insurance does not cover the cost of telescopic lenses he needs to work. His employer pays for the item and any needed repairs. His employer has also paid for 2 other supports he needs to do his job, a larger computer monitor and staff support. JK does not incur any out-of-pocket costs for needed supports. So the study offers some insights about the support needs of 15 workers with disabilities from their own perspectives. First, the types of supports and accommodations used varied based on the functional needs of workers. For example, individuals with motor limitations benefited from changes to their work site to facilitate environmental access, whereas those with sensory impairments utilized communication devices and visual aids. Second, the process of identifying and providing needed supports was very individualized. In most cases, participants negotiated with their employer up front to have needed supports in place at the start of the employment, and then adjustments were made while on the job. Third, many supports such as adaptive office equipment, a flexible work schedule, and informal supports were not costly or resource intensive for employers to provide. Fourth, the types and amount of out-of-pocket costs incurred by participants varied substantially due to differences in individual needs as well as the scope of insurance coverage. Personal care assistance was the most costly work-related expense incurred by one individual. And finally, participants were very strategic in obtaining equipment and supports that effectively met their needs. Individual specific needs, their job duties, and the extent to which the costs were covered by their insurance or other sources all factored into the specific challenges they encountered and the solutions they devised to stay employed. Thank you.
Thank you, Noelle. So before we hear from Dave, I'd like to remind our webinar audience that we'd love to hear from you. Please submit your questions now via the Q&A panel on your screen, and we will direct them to one of our speakers during the Q&A session. Dave? Dave is just fixing his microphone.
Do we have live webinar quiz results? I'm very excited about this. Oh, excellent. Let's just say the webinar audience did slightly better than the in-person audience. So what I'd like to do today is discuss these papers, and I wanted to make 3 points. First, I wanted to remind the audience of the unifying themes across these papers. And as Yanni had mentioned at the outset, there's a lot of concern about the declining employment rate of people with disabilities. And I wanted my presentation to be the upbeat part of the tone, which is one of the unifying themes is that these are all about people with disabilities who are making it in the labor force. So the findings tell us something about who works, but it doesn't tell us, or it doesn't tell us anything about who wants to work or who can work, which are the trickier questions. The second point that I'm going to make in my discussant remarks is I'm going to provide a brief overview about how the papers are tied to the literature. And in brief, I think one of the points that each of the papers make is that there is a diversity of outcomes. This is a heterogeneous population of people with disabilities that have a range of impairments that also has that spans the age distribution. So their supports and their needs very, very much differ. And so their outcomes, perhaps not surprisingly, vary by age, impairment, and state. And that's consistent with findings for the broader population. But equally important is this idea of unobservables. And I thought that this is both the technical point that John's paper struggles with in terms of how do we do a match and make sure that we're matching like people, but it's also the point that Noelle's paper was making in terms of who uses accommodations and just the diversity of those accommodations. A lot of times we talk about needs for transportation supports, but as her presentation effectively shows, the way that those transportation supports are needed in the accommodations really vary from person to person. And third, last but not least, I'm going to go over the quiz results. And I have to say, when Crystal, to my left here, introduced the quiz results, I was delighted, and I think our team had a lot of fun developing them. But our main goal was not really to torture you, was that actually to provide go over what we know of who works, and perhaps most importantly, what we perceive on each of these questions. And another advantage is that it was a way to get my face off of the slides here, because I was afraid they would introduce a polling question of, is this a good picture? And the answer would be no and no. So Anyways, so in summary, I think it is difficult, based on these papers alone, to make suggestive policy reforms outside of supports for those that are already receiving disability benefits. But they are part of a broader set of evidence on who is working and how they're using existing supports. And if there is a recommendation for all of them on the research side, is to dive a bit more detail into the context, particularly at the state and local levels, to understand what is going on in terms of the availability of the accommodations, the service use, as well as employment outcomes. So what are the unifying themes? I think the unifying themes are really that we're dealing with a select population here. These are disability beneficiaries who are working. This represents a relatively small portion of the overall DI population. When I say small, a minority. It's less than 20%, but that minority grows when you look longitudinally, as Arif shows in his paper. It's notable that the people that we're looking at today are achieving outcomes such as substantial gainful activity, or even suspension or termination due to work, which is STW, which I always have to remind myself is people leaving the programs due to employment. So these are really substantive employment goals that people are achieving. And even the enrollment in services is notable, particularly given some of the other issues that these populations face, including the severity of their disability, as well as the work disincentives and the program fragmentation generally. So let's first turn to Arif's paper. And if there's a takeaway from Arif's paper, it's really how much outcomes varies by group. Youth matters is probably the first point. In one of his slides, he effectively shows that younger beneficiaries, which he defines as age 18 to 24, which is basically younger than everybody in this room, is 25% of them had a service enrollment outcome, and 12% had left the rolls. By comparison, when you think about the majority of beneficiaries who are actually on the rolls, which are people over the age of 50, only less than 5% had either service rates or leaving the program due to work. So there's a real difference between younger and older populations in these outcomes. And I think what Arif's paper does is provides new evidence on the magnitude of the difference. Second of all, they show that there are differences across impairment groups. People with sensory and intellectual disabilities are generally more likely relative to other groups to be working, and in part that might reflect their younger ages, which they control for later in the study with their regression analysis. The third point, and the point that I find most intriguing, is the state variation that they find in their analysis, and particularly some of the regional patterns. The higher performing states are harder to follow in terms of their general regional patterns, but the lower performing states tend to be concentrated in the southern regions. And I think that is notable to ask sort of what's going on. And this finding is also consistent with other disability statistics. For example, if you look at New Hampshire's disability compendium and you take a look at distributions of employment rates for broader populations of people from the American Community Survey or for the current population survey, you see these differences in employment rates. And it really is suggestive of something's going on at the local and state level that perhaps is driving these variations. And finally, as one of the quiz questions that I'll get to, is there's differences across the economic cycle. People with disabilities, employment rates, much like all people, are sensitive to the economic cycle and perhaps are in many ways more sensitive because they're more at risk of losing jobs. John O'Neill's presentation showed us that VR participants in DI experience what I'll call a bump. It's that notch in John's presentation, the chart in outcomes following VR enrollment. And he was very careful to use the term association, both in his presentation as well as in his paper, and that there's an increased correlation or association between VR and DI nationally. And so one of the challenges, though, is kind of understanding, well, VR is a very different program, so when you aggregate it across states, what does it mean? What his findings do show is, at least nationally, there are these positive correlations. And so I think as we digger into figuring out what's going at the state level, we might find variations in those associations. The other thing that I think is very interesting about what he does is that third line in his graph, which basically suggests that if you just compare VR participants to all beneficiaries, what you'd get is a much bigger association. So that already suggests immediately that VR participants are different from non-VR participants on observables. And the next trick, and this is why the outcomes are associations in John's study, that is trying to match on those unobservable factors, which is very difficult. The final study is Noelle's study, and she really puts a personal perspective on this issue and talks about accommodations. And the takeaway that I've got from Noelle's study is, I call it common barriers, but different solutions. So we often hear of commonly reported barriers in the literature, such as issues with physical workspace. I just had an issue with my microphone falling off of my ear, and I was accommodating with this thing. So, but there are these other issues, transportations and costs. What I liked about Noelle's presentation, what I think was innovative, is the solutions that she showed up and the contrast that she had were different from individual to individual. Think back to the transportation example that she had between DW and O. One person needed a physical accommodation with a van, and the other needed to train a guide dog around the local transit system. Very different ways of thinking about transportation, and not necessarily ways that are immediately obvious to a research audience or maybe even a practitioner audience until you start talking to the person with a disability about their individualized needs. The other thing that I think is really noteworthy about her presentation, something that I definitely would like the audience to take away, particularly based on the quiz results, is that the costs are relatively cheap for accommodations. And this reinforces the findings from the Job Accommodation Network from the Department of Labor that accommodations are often not costly. And they report in one of their surveys that 50% of the cases cost nothing, and many of the accommodations cost less than $500. So how does this relate to the previous literature? And one of the things that I do want to do here is compare it to a special journal volume that Gina Livermore, David Newmark, and I recently edited called Alternatives to Disability Benefit Receipt, where we had 8 articles published by people that are very notable in the field, such as Dave Stapleton, John Bound, Jeff Smith, and Rich Burkhauser, and many others, including some on the panel. The articles examine different facets of employment and program participation in the US and abroad. And for those interested in this special journal volume, the easiest way I can say to find it, if you're on Google right now, is just Google Mathematica IZA, and the special journal volume will come up on the Mathematica website. So one of the themes that came out of this journal, and also comes out of today's presentation, is that state and age variations are huge factors. The variations by state and age brought forth in both Arif and John's presentations are prominent themes in the volume introduction that Gina, David Newmark, and I wrote, as well as other papers on employment rates, disability application, and VR processes. The subgroups of people with disabilities really use these services very differently and have different levels of access to the services. 2 of the reports, I should say articles in that special volume are particularly noteworthy because they focus on vocational rehabilitation. And like the studies today, they show a strong association between vocational rehabilitation and what some might consider positive outcomes, which are reduced likelihood of going eventually on to SSI or leaving SSI and SSDI due to work. The first study was by David Dean, and his colleagues at Virginia. And what he did, he used longitudinal data from the state of Virginia and found that VR services were associated with lower rates of participation in disability insurance, lower take-up rates in SSDI and SSI. And I think what was one of the most interesting aspects of their study was that, that substance matter, the amount of time the vocational rehabilitation and the type of services that were provided to the participant were correlated with stronger outcomes, with more intense services leading to stronger outcomes. The second paper that I wanted to highlight from that journal was from Jody Schimmel-Hyde and her colleagues that showed that the timing of service delivery also mattered in VR, particularly in the states of order of selection. And after controlling for whether or not a state was in order of selection, they find in states with fewer available services, there were higher rates of disability applications. Hence, again, this theme of timing and availability and access to services matters. And people using VR services are fundamentally different than other beneficiaries that are on the rolls. So what do we take out of this? First of all, there's more associative evidence that dovetails nicely with the findings of this panel. But the second thing that I want to caution, and this was a caution also in these journal articles, associations are not impacts. So we should not take away that these higher associations in VR means that VR is having 8 percentage point impacts on outcomes. So for example, one reason not to do that is because the decision to obtain VR services is not likely to be a random event. Because unobserved factors such as severity of disabling condition and general health status, which likely influence the exact outcomes that we care about, including participation in VR as well as employment, are likely to be jointly associated with VR services and SSDI receipt. To give an example of where this can go wrong, you just need to look back to the state partnership initiative that was funded back in the 90s. And in that initiative, what they did was they compared evaluation outcomes using random assignment and a non-random assignment algorithm. And what they did was they did a match similar to what John's team did, and they found, like John's team, that there were strong match rates. But the problem was that the outcomes from their non-experimental results did not match the experimental results. And so that is a reason why you have to be careful in terms of trying to draw impact conclusions from things that are associations. This does not diminish in any way the need for associative evidence. As a matter of fact, it's very useful and critically important in the absence of the things that we're missing for VR, which is actual experimental evidence on its efficacy. So the work that John has done, as well as Arif, fits very nicely in filling that gap. And the fact that they went further and showed that the associations change when you use likewise comparison groups, I think is a really important and insightful finding. So, how did we do on the test? I have data, and I'm going to use it. So on this first question, which DI award cohort had better 5-year return to work outcomes? The answer is 1996. And this admittedly was a hard question, and 60% of the webinar audience got it right, and I roughly estimate that's what our in-person audience got as well. And I think the rationale is there are 2 factors that are driving this result that you have to think of. The first is who's coming on in 1996 and in 2000. In 1996, you're in the middle of an economic expansion, and in 2000, you're right at the end of the economic expansion. The recession hasn't hit. So you've got different populations that are coming onto the rolls, and you could argue that the people coming on in 2000 may have been in worse shape, so to speak, in terms of unobservables. But the other factor you can't discount is the fact that the economic conditions post-1996 for their follow-up were better than 2000. And even though that there were controls for employment rates and unemployment rates and macroeconomic conditions, those controls might not have captured everything. So that's the logic. So 60% of you got it right, 50% would have got it right by chance, so not so good. But that's actually the best you guys did, so maybe we should take that. The second question is, how likely are beneficiaries who receive SVR services to leave the Ssdi program due to employment compared to the comparison group? The answer is 8 percentage points. And again, this was probably a hard question because we're being unusually specific, but we tried to range from low or no impacts to the highest association. I shouldn't use impacts. And the answers were between 0, 4, and 8%. And 4% of our in-person audience got this right. 17% of our webinar audience got this right. And if you were to answer this randomly, 33% of you would have gotten it right. So I think that this is important in terms of making the point that after you control for comparisons between VR participants and non-participants, these associations are still pretty high. And I think that that's an interesting source of evidence. And then finally, of the 15 workers interviewed, how many spent more than $2,500 each year for work-related supports? And here, the webinar audience did much better than the in-person audience, but still would have been better off randomly guessing. The webinar audience got 27% right. The in-person audience, again, there was one sole person that I think got it right, according to my unofficial counts. And again, the takeaway here is that Noel finds 3 people out of her 15 had large costs for work-related supports. And the point that I really want to make with each of these questions is hopefully this will crystallize some more of the takeaway messages. We have a lot of sophisticated researchers and practitioners in the audience, and we're still having new findings. And I think that that is a really important lesson from this panel, and hopefully it will be a key takeaway as we go forward. So, in summary, as I said at the outset, I view each of these papers as a piece of the puzzle, suggesting that success is possible even for those that have been on the disability program for quite some time, despite the severity of their impairment, as well as some of the severe work disincentives. But it occurs for relatively small portions of the populations, and it takes, equally important, some time to develop. Questions remain I think, for why such large variations exist for states. And as we think about this, I think what we want to think about is, well, how can we come up with creative and customized supports at the state levels? And I think that there are options for intervening with these populations, but it's going to have to go beyond what we ordinarily think of. If we think that we have the answer, we probably don't, because of all of the creativity that goes on with getting somebody employed. And so I think the big trick here is to figure out exactly how to craft those approaches, given that there are such strong differences in outcomes, and really to figure out how we select approaches and customize those approaches, not only by specific subgroups, which seem to matter, impairment and age, but also understanding the local economic context and differences by states. So I will leave with that summary and turn it back over to you, Yanni, to take any questions.
Thank you, Dave. Okay, so this is the Q&A session, and we look forward to answering as many questions as time will allow. Whether posing a question in person or online, please be sure to state your name and affiliation, and limit your comments to one question only, as we want to allow enough time for everyone to ask questions from our distinguished panel. And I'll start with seeing if we have any questions from the online audience.
We do. The first question comes in from Joanna Richard. It's great to see that SVRAs have been more successful at Ssdi return to work, but our experience at our SVRA is that once obtaining Ssdi, it's very hard to move to employment. Do you have any observations of a possible diversion program before obtaining Ssdi that could work?
I think that's for John.
I wish I did. No, I think that actually CSAVR put out a red paper, I think they referred to it as, which has a diversion plan. Now, whether that has not been implemented, I don't think it got too much attention. But if you go on the CSAVR's website, you can find that approach. And I don't remember the details. It did have something to do with the collaboration between the Social Security Administration, between the eligibility folks at SSA, and the DR. It was bringing them together again. In many states, they were housed under the same administrative agency, and for quite a while. But as I understand it, when the ticket came into existence, it kind of it separated the Social Security Administration from the VR offices.
Anybody else want to add anything?
Yeah, I think that it's a really good question, and one that's really hard for us to answer because we don't have an evidence basis of how it would work, so anything that we describe would be policy option-ish. But I think there are ideas to, for example, link VR more directly with SSA in the SSA office for people that do not meet or equal the impairment listings. For earlier intervention approaches. And I think the WIO legislation has a much stronger emphasis on moving VR into focusing on younger populations, which is perhaps where they're going to have the strongest return to work efforts. And if you look at VR incentives right now, their incentives are to serve the populations that have the most severe disabilities, and so SSI and Ssdi receive priority, and those are exactly the groups that are hardest and most expensive to place, despite some of the associative evidence. And so I think it's turning some of these incentives around so that we can invest VR more efficiently and more cost effectively, either with younger populations or earlier in this SSA process. And some would say, even if you linked it at the SSA process, it's still too late because people have come to SSA, are strong options for moving forward.
Yeah. Any questions in the audience here?
Yeah.
Oh, sure.
I would just add to Dave and John's comment about actually referring back to a study that, Dave, you referred to, David Dean and his colleagues. The study, if I remember correctly, does show that even VR services actually are associated with lower engagement into SSA, disability beneficiaries. So that's some evidence to rely on. So even falling back on VR ahead of time could help.
Thank you. Over here. Please state your name and affiliation.
Hi, I'm Jen Rigger from the Office of Demonstration, Research, and Employment Support. I got that wrong. It's a new name, sorry. My question is for John O'Neill. I'm curious, you've got your selection bias wall that you kind of hit with what you were looking at for this paper. Are you seeing limitations of the 9/11 DAF match with that, or is that data set still mineable in terms of your remaining variable questions?
Yeah, the matching, maybe I can address this, I'll try. Arif participated in this study too, so the variables for the match were pulled from the Social Security Administration's administrative files. And so we didn't use the variables in the 9/11 files. One of the reasons for doing that is that we believe that at least I think we believe, that the Social Security Administration's administrative files, the data in there is probably better checked, more reliable than might be the case, than probably is the case in the 9/11 data set.
I would just also add that for our analysis, we needed data on beneficiary characteristics for both groups that were affiliated with VR and as well as those who didn't. So obviously, we didn't have data from RSA for those who didn't apply to VR. So that's one of the reasons we actually had to use the beneficiary characteristics from the disability analysis file from SSA.
So if you could have used the 9/11 for non-beneficiaries, you might have been, okay, all right, thank you.
Okay, we'll go back to the online audience if we have a question from them.
Sure. We have a question from Andy Kistler. It's apparent that SVRA is effective. Individuals receiving DI at younger ages are best positioned to earn their way off the entitlement system, and folks on the system longer than 5 years are more apt to return to work. So where do we go from here?
It's a big question.
I'd start off with basically pointing out what John has mentioned, and then Dave reinforced, that I would caution about interpreting these results as causal impact estimates. These are suggestive evidence of strong positive correlations, that VR services tend to be associated with higher likelihood of returning to work among DI beneficiaries who turn to VR for support services. And analytically for us, the challenge is what we're seeing in the data is even before they applied for VR services, in terms of the outcomes we observed, there are significant differences. And unless we're able to account for those, I don't interpret those as causal estimates. I guess a follow-up question could be how do we use these suggestive evidence on positive correlations? That is a hard puzzle to resolve. But possibly that could indicate that support provided to particular groups of beneficiaries, like younger beneficiaries that Dave was referring to, or specific impairment types, could be useful for having people return to work. But getting a conclusive evidence would be really hard to do. John or David, I don't know if you want to add anything.
Do you mind if I add in? I think one place that we do want to go is to look at the states that are doing better and try to understand why they're doing better on certain outcomes, and to assess whether or not that is even better, or if it's due to a fact that the VR agency has a different focus, whether it's an investment more into education or employment services. Because it's possible that the numbers that are being driven here are being driven by some states that do much better in serving these DI beneficiaries than other states that maybe do not have this focus. So I think that's the next place to go. And I think what's neat about the RSA 9/11 data is that we've just started using them. And so doing these national level analysis is starting to break the ice. And now the next level is getting deeper into understanding the why, so that the VR agencies can start to make more practical use of these data and to better understand the outcomes at their own level.
John, did you want to add anything?
One comment. We did have 36 variables that we matched on, all of which have been shown in the past to be related to employment outcomes for the most part. And we were able to match on 34 out of 36. And even with that power of the matching process, that we were able to to accomplish. Even with that kind of power, we still saw differences between the match control group and those who applied for VR services during the baseline period. And that's the finding that we need to take away, a finding that, as Dave Wittenberg said, we need to be very cautious about interpreting these results, even though they are promising in some respects.
Thank you. Another question from the audience? Over there in the back?
This is Crystal Blyler from Mathematica. I want to follow up on that. I've never heard so many caveats about such a compelling-looking finding before, and I'm a little baffled about it because it wasn't an impact analysis, but there are other ways to infer causal effect other than the kind of impact analyses that economists do. There are strong case study designs, which is sort of what you've done here. If you show the same effect over and over again, the timing effect is what I'm talking about here. I mean, what is the alternative explanation for why, no matter how you cut it, the effect for this group always occurs right after they apply for SVRA services? What's the alternative explanation for that? And I can think of one, but I'm just wondering what you're all thinking it is, since you're so convinced we should not interpret this as an impact.
You or me?
How are you?
Go to Rick. A possible interpretation could be the sheer timing of somebody's health condition improving could be closely correlated with when they go out to VR to apply for services. Or perhaps the local economic condition could affect when somebody chooses to go VR. So the notch that Dave mentioned happens exactly around the same time because people are choosing to go to VR right around the same time. And from observable characteristics, we can predict why they choose at that time.
Yeah, I would agree with that. I mean, I think the issue is that they have made the mental decision. They've made the select decision that they're going back to work. They're going to get some type of support, and that makes them selectively different from a population that you can't see. So if you were to do this again, for example, with a waiting list, that would be a more compelling set of evidence than doing this comparison, because the counter to that, Crystal, is that we do have evidence where this didn't work, where the causal evidence of this exact type of match was problematic in Ssdi, when you got one set of impacts from the random assignment approach versus a different set of impacts from this propensity score matching approach. So that's why I think there's so much causal concern. And this is not just with VR, this is with job training programs, and so there's sort of a long history of this.
Right, so where we go next, I was thinking, I wonder if there's a way to look at the data about the people who, break down the people who applied into those who applied and got services versus those who applied and didn't get services, but maybe there's not enough people in that second category to look at that.
We did not look at the data in that fashion, and I think that would be a very useful next step, because we are looking at folks who applied for services and got as far as having an individual plan for employment. We did not look at those who applied and dropped out prior to that, and there's probably a large enough sample to actually do such an analysis.
I'd like to go back to the, okay, no questions from the online audience. I know there's somebody at the back there who wants to ask a question.
I'm Phil Gilliam. How many people move from one state to another, or within a state? Well, I guess from one state to another to take advantage of differing economies, maybe perhaps better VR services. How often do people move to get better jobs?
Anybody know the answer to that?
Good question.
A good research question.
Yeah.
It is a good research question. Just anecdotally, I don't know about, well, certainly people move for better jobs. I do know that many families with kids who have disabilities move to communities that they consider will serve their offspring better. And I've heard that again and again from parents of kids with disabilities. Whether it is mirrored in the adult population, I don't know.
I think it is a really good question. I think the hard part is sort of differentiating by income levels, too, in terms of your ability to move and understand what the available access to services is. Unfortunately, we just don't have an evidence basis to track how many disability beneficiaries have moved across state lines or how many people with disabilities move across state lines. You need a longitudinal panel. It have to be really large, too, because moving is a pretty big event. So fortunately, I don't know is perhaps the best answer. But I have theories.
Okay, I think we need to wrap up. We hope you enjoyed today's discussion. Please be sure to let us know how you think we did by completing the comment card in your packets or the electronic survey offered to our webinar audience. And please mark your calendars for, Yep. We will have our next Disability Policy Forum on December 4th, where we will discuss new data on the well-being of people with disabilities. And please join me in thanking our speakers.
This doesn't want to seem to shut down.
I had a question for you too, but there was no time. So I don't have that. It was more just thinking, it was kind of for the group about the interaction of individual characteristics and services. Because what was striking me about your presentation is that it looks like it takes a lot of intelligence, creativity, and personality to figure it out. And I think if where services are more available, that would be less a factor, and where services are less available, then that's all you got to rely on.
And most of these people have
They didn't mute either.